My name is Suzanne Narrow, and I'm a policy advisor at the Global Strategy Lab's AMR Policy Accelerator. Antimicrobial resistance, or AMR, is one of the world's largest health threats, making infections difficult or even impossible to treat. Research on diseases like HIV and AIDS, COVID-19, and Ebola show us that gender plays a huge role in how likely people are to get sick and the kind of healthcare that they can access. But despite this, there's currently limited research that considers the impact of gender on AMR. So our study gathered global evidence on how AMR differently affects the health of women, men, boys, girls, and gender diverse populations. Now let's dive into some of the key findings from our research. Harmful gender norms, such as valuing boys over girls, can lead to boys having greater access to food and healthcare, leaving women and girls more vulnerable to infections and limited treatment options. Limited time and financial resources can hinder access to timely diagnosis and appropriate treatment. So we saw that both men and women may resort to self-medication due to cost or time barriers. Health-related decisions often rest with men or senior household members, so women frequently rely on informal or low-cost remedies when denied access to household finances. However, workforce participation can actually enhance the autonomy and decision-making power for women related to seeking diagnosis and treatment. We also saw that patients who are women can also experience inequitable relationships with their practitioners. Fear of displaying disobedience, lack of respect, or portraying a lack of trust to healthcare professionals can deter women from having agency in their healthcare decision-making and could also lead to inappropriate antibiotic use. Restrictive laws such as anti-homosexuality laws, gender-blind laws, and other legal frameworks that discriminate based on sex, gender identity, or sexual orientation can negatively affect access to healthcare for women, men, and gender diverse populations. Some ways that we can address gender inequalities in AMR include improving the structural and social determinants of health, for example, by creating more equitable policies and providing universal health coverage so everyone can access healthcare equally. Involving women, men, and gender diverse populations at national and local AMR governance structures, technical working groups, and leadership positions within the health system to help design strategies that reduce gendered barriers in accessing healthcare. It is also important that researchers collect, analyze, and use gender disaggregated data on AMR to inform interventions aiming to promote equitable access to prevention, diagnosis, and treatment for DRIs, especially for women. If you're a policymaker, a healthcare worker, or a researcher, I strongly urge you to review this research because better understanding of how gender dynamics can impact AMR health outcomes can allow policymakers to develop gender-responsive policies for AMR. Awareness on stigma, gender roles, and financial, social, and cultural barriers can allow healthcare workers to better support vulnerable patients. This research highlights the importance of integrating a gender perspective into the design of AMR policies, programs, and interventions. By incorporating a gender lens to address these inequities and support better healthcare access, we can build better policies and mitigate the spread of AMR.